everyone, I'm Gina de la Cruz and we are the group leader to discuss the tuberculosis.
What is tuberculosis? Tubercle means round, nodule, or swelling in the lungs. Osis means condition. Tuberculosis is a potentially serious infectious disease that mainly affects the lungs. The bacteria that cause tuberculosis are spread to person to person through tiny droplets released into the air via coughs and sneezes. Tuberculosis can also spread to other parts of your body, like your brain and spines. A bacteria called Mycobacterium tuberculosis causes it.
Signs and symptoms of tuberculosis. The majority of people exposed to the bacteria don't experience tuberculosis symptoms right away. Instead, the infection may go into 3 stages. The first one is primary TB infection. This is when the bacteria first enter your body. In many people, this causes no symptoms, but many experience fever or pulmonary symptoms. Most people with a healthy immune system will not develop any symptoms of infection. But in some people, the bacteria may grow and develop into an active disease. Most of primary TB infection are asymptomatic and followed by a latent TB infection according to the Center of Disease Control and Prevention, or the CDC. The second one is the latent TB infection. The bacteria is in your body and can be found through tests, but is not active. During this stage, you don't experience symptoms and can be spread the disease to others. Notes by the National Library of Medicine. Third one and last is the active disease. The TB bacteria are active and multiply. You will feel sick and will be contagious. It is important to seek immediate treatment to avoid complications and to infecting others. The signs and symptoms of active TB include coughing for 3 or more weeks, coughing up blood or mucus, chest pain, pain with breathing, unintentional weight loss, fatigue, fever, night sweat, chills, and loss of appetite.
Causes. Tuberculosis is caused by bacteria that spread from person to person through microscopic droplets released into the air. This can happen when someone with the untreated active form of tuberculosis coughs, sneezes, spits, coughs, or sneezes. Tuberculosis is spread through the air, which means you can get it by breathing contaminated air. If someone who is actively sick, coughs, sneezes, or spreading can spread tuberculosis. The bacteria do not live on surfaces, so you can tuberculosis more. Shaking hands, using a toilet, eating utensils, sharing drinking glasses or eating utensils, touching other surfaces. People with a weakened immune system have the higher risk of getting infected with tuberculosis. We particularly worry about people with HIV or AIDS because their immune system can be overwhelmed by tuberculosis, says Dr. Hamler. Risk factors of tuberculosis include poverty, HIV infection, homelessness, being jailed in prison where close contact can spread infection, substance abuse, taking medication that weakens the immune system, kidney disease and diabetes, organ transplants, working in healthcare, air pollution, cancer, smoking tobacco, pregnancy, age especially babies, young children, and elderly people.
Tuberculosis risk factors you could be more likely to get TB if the first one is a friend, coworker, or family member has active TB. The second is you live in or have traveled to an area where TB is common, like Russia, Africa, Eastern Europe, Asia, and Latin America, and the Caribbean. Next is you're part of a group in which TB is more likely to spread, or you work or live with someone who is. This includes homeless people, people who have HIV, people in jail or prison, and people who inject drugs into their veins. The next one is you work or live in a hospital or nursing home or home. Next is you're a healthcare worker for patients at high risk of TB. And lastly, you're a smoker. How tuberculosis diagnosed? There are series of screening and tuberculosis tests may be needed in order to confirm TB and decide on a course of treatment. Since latent TB has no symptoms and fever bacteria are present, it can only be found in a couple of screening tests. The first test used to find TB is called the tuberculosis skin test, also known as the Mantox test or PPD, purified protein derivative. A solution made from TB bacteria is injected in the top layer of the skin on the forearm. The person will be returned 48 to 72 hours to have the infection site examined. If there is a red raised bump larger than 5 to 15 mm, a TB infection will be present, but this test is in a perfect science. Sometimes result can be wrong, showing false positive or false negative. A blood test can provide more exclusive result. Interferon gamma release assay or GRE is the test that measures the body immune response to the presence of M. tuberculosis. The test is done in a lab after a blood sample is taken. The next test is sputum sample. It is the mucus that comes out from the cough. Sample of sputums can be directed examined in a lab for M. tuberculosis. The next test is molecular test. This can be used to detect the bacteria's genetic materials and help identify which antibiotic will gonna work best.
Biopsy a biopsy of the lungs. Lymph nodes or other tissues may be cultured to grow the bacteria and make it easier to see under a microscope. X-rays, chest rays may be done to look for signs for tuberculosis in the lungs. Computerized tomography scans may be used to look for tuberculosis in the spine to get better views of the lungs if X-ray images are located. Magnetic resonance imaging and MRI of the spine or brain may be done if doctors think the tuberculosis infection has spread to those areas. Bone scans, this can be used to tell the difference between cancerous lesions and those caused by tuberculosis. Prevention of tuberculosis, keeping your immune system healthy and avoiding exposure to someone with active tuberculosis is the best way to prevent a tuberculosis infection. Identifying and treating causes of latent tuberculosis before the disease can become active is also important, particularly in high-risk populations. To prevent the transmission of tuberculosis in healthcare settings, the CDC places guidelines that require most healthcare personnel to screen for tuberculosis when they hire. Other steps forward preventing the spread of tuberculosis include improving ventilation in the indoor spaces so there are fewer bacteria in the air receiving. Hermetical EUV lamps to kill airborne bacteria in buildings where there are people at high risk of tuberculosis, using directly observed therapy, in which people taking medication for tuberculosis are monitored by their healthcare providers to raise the likelihood of successful
Prevention. If you test positive for latent TB infection, your doctor might advise you to take medication to reduce your risk of developing active tuberculosis. Only active TB is contagious. Prevention. The first one is protect your family and friends. If you have active TB, it generally takes a few weeks of treatment with TB medication before you're not contagious anymore. Follow these tips to help keep your friends and family from getting sick. The second one is stay at home. Don't go work or school or sleep in a room with other people during these few weeks of treatment. The third one is ventilator room. Tuberculosis Germs spread more easily in small closed spaces. When air doesn't move, it's not too cold outdoors, open the windows and use a fan to blow indoor air outside. Next is cover your mouth. Use a tissue to cover your mouth anytime you laugh, sneeze, or cough. Put in a dirty tissue in a bag. Seal it and throw it away. Next one is wear a face mask. Wearing a face mask when you're around other people during the first 3 weeks of treatment may help lessen the risk of transmission.
What's the treatment and cure for tuberculosis? With the proper treatment, tuberculosis TB, for short, is almost always curable. Doctors prescribe antibiotics to kill the bacteria that cause it. You'll need to take them for 6 to 9 months. What medications you take and how long you have to take them depend on which works to relieve your TB. Sometimes antibiotics used to treat the disease don't work. Doctors call this drug resistant. TB, if you have this form of the disease, you may need to take stronger medications for longer. Treatment for latent TB. These are 2 types of TB, active and inactive. Depending on your risk factors, latent TB can reactive and cause an active infection. That's why your doctor might prescribe medication to kill the inactive bacteria just in case. These are the 3 treatment options. Isoniazid. This is the most common therapy for latent TB. You typically take an isoniazid antibiotic pill for daily for 9 months. You take this antibiotic each day for months. It's an option if you have effects or isoniazid and rifampicin. You take both of these antibiotics once a week for 3 months under your doctor's supervision. Treatment for active TB, if you have this form of disease, you'll need to take a number of antibiotics for 6 to 9 months. These 4 medications are most commonly used to treat. Your doctor may order a test that shows which antibiotics will kill the TB strain. Based on the result, you'll take 3 or 4 medications for 2 months. Afterward, you'll need 2 medications for 4 to 7 months. You'll probably start to feel better after a few weeks of treatment, but only a doctor can tell you if you're still contagious. If you are not be able to go back to your daily life.